Typically it'll take between 5 and 10 minutes, and it really depends mostly on the patient and whether they're able to focus on the little light that we have them focus on. So if somebody is able to see the light and focus on it really well, it might take me 5 minutes to do. And if somebody is moving or looking around, it might take about 10 minutes to do. But it's a topical anesthesia, so that means we use lidocaine gel to numb the eye, and then we use liquid lidocaine inside the eye, so it's a very comfortable procedure, and it should take roughly 5 to 10 minutes. We did a pretty large pain study where we asked patients on a scale of 1 to 10, how much pain did you have during the surgery? And this is right when the patient sat up after surgery. So they would point to a little face and say it's a 0 or a 10, our average was 2 to 3. Some patients were pointing at 6 to 7. So then we introduced intracameral lidocaine. So we started using liquid lidocaine inside the eye, and then we redid the study, and everybody was 0 to 2. Most people 0. So it should be a painless procedure. If somebody is having pain, we give extra lidocaine. That usually takes care of the problem. And if somebody is just not able to tolerate the surgery at all, we have injectional anesthesia as well.